Morning, my people. It's me again, Dr. Essie. Thank you for following me and thank you for watching my videos. Today, I'm going to be talking about the signs and symptoms and going through some of the management of infertility. Now, I've talked about the risk factors. I've talked about it for both male and female. Those are the things that usually cause a man or a woman not to be able to conceive appropriately. Now, another thing that I want to just talk about, I want to talk about signs, symptoms. What would you know? It's very easy. When a man and a woman has been together for 12 months, and the woman is below 35, and they have been trying every month to conceive. And that means that the man and the woman has to be together for 12 months, having intercourse for at least 3 times a week. Not the one who they are married, the man is in Abuja, the man is in Lagos, and they are not having intercourse regularly. So no, that's not it. So they are having unprotected regular intercourse for at least 3 times in a week for 12 months. For people that are older than 35, we say less than 6 months, when they are having regular unprotected sex for 6 months, then we can say they are infertile. Then again, a woman that is always having repeated miscarriage, she's not able to take a child to 10. So it's not just that she's not getting pregnant or she's getting pregnant. If she's not able to take that pregnancy to 10 or give birth to a live baby, then we can also consider that as infertility. And when all those things happen, when a man, how will you also know if a woman is not having seen her period? You know that there's a problem, so let's look into it. If a woman is having excessive bleeding, you say, let's look into it. Or if a man is having erectile dysfunction, low libido, and you look into it. But the major thing when it comes to infertility is inability to conceive. Now, what would you do when they come and say, they are not able to conceive? What would you do? The first thing you're supposed to do is to take a proper history. You have to take a proper history. Has she had miscarriages before? Is this primary infertility? She has never been pregnant before? Is this secondary infertility? She has been pregnant, maybe something has happened. So these are the things you do. You have to take a proper history. Then you do into proper investigation, hormonal profile, blood, look at the medication that the person is taking, do a thorough investigation, look at the lifestyle, look at their physical health, all those things. The proper history, proper examination, proper investigation will be done. When you are done all those things, you can now say, let's now dive into the management. In my next video, we'll start talking about treatment options and what can be done for this individual.